Hi everyone, I am Dr. Natesh Prabhu, Men's Health Consultant and the Medical Director of Andregn Clinic, Trichy, Tamil Nadu. In today's session, we're going to talk about what are the things which a diabetic patient with erectile dysfunction should do, should not do, and what are the things he should remember, and what are the signs and symptoms he'll be presenting with. When the patient is having diabetes, he'll be having general signs of diabetes, but a diabetic patient can come with a symptom of sexual dysfunctions. Patient with the unknown state of diabetes can present to us with a erectile dysfunction, loss of libido, and even somebody can present with infections in the pineal skin. What he should do? He should be consulting a diabetologist and checking his blood sugar levels, and he should be monitoring periodically at home with a home-based measuring devices, which is very important. Else what happens? Some people, they forget that they are diabetic and they tend to pop on pills which we give for erectile issues. So once these pills start to act, they'll be happy. When these pills fail to act, then they come back to us, and then when we check, their sugar levels will be very elevated. So they have to monitor the sugar levels and they have to maintain it at very tight glycemic range. This is one which they have to remember. What they shouldn't do, they shouldn't hog up on things, because diabetic diet is a very strict component. They should take a lot of fruits, as I told you earlier, a lot of vegetables, a lot of high fiber diet, less amount of fat, less amount of sugars, and more amount of protein. They should be doing a lot of exercises, and they should be doing yoga pranayama, and they should be doing a lot of physical activity. And inactivity is a big no, because more amount of activity can improve the insulin sensitivity and thereby increasing the diabetic control also. And increasing activity can also release a lot of endorphins and thereby improving the sexual mood. And the things to remember, very important: when you are on PDE5 inhibitors, don't consume alcohol. When you are on PDE5 inhibitors, don't consume nitrates. If you are on nitrates, if you are consuming alcohol on a daily basis, and you should always consult your sexual medicine expert or a sexologist so that he may titrate the dosages depending upon your requirement. For example, if the patient is on nitrates, we might alter the dosages, or we might change the time of PDE5 inhibitors for the patients. PDE5 inhibitor means the drugs which are given for erection issues like Viagra or Cialis. So for the men with PDE5 inhibitors, nitrates are a big no, and alcohol are a big no, and they should remember that these drugs, nitrates and alcohol, are big contraindications for men with PDE5 inhibitors like sildenafil or tadalafil. So they have to remember, and most importantly, they should remember that always strict monitoring. Home-based monitoring is very important. Maintaining a strict glycemic control is very important, and physical activity and improving the physical activity is very important. And daily frequent physical activity is also a good physical activity, which can also improve the mood, which can also improve the diabetic control. So monitor yourself frequently at home, and you consult your diabetologist frequently. Maintaining diabetic control helps you to give good erection even if you're on pills. Poor diabetic control will give you poor erections even if you're on pills. That is a very a common saying. So a strict diabetic control is very important. With recent modalities, even various regenerative therapies, various nutraceutical medicines, shockwave therapies are available for diabetic patients with erectile dysfunctions. So you should consult your diabetologist. So please remember all these things and stay safe. Take care.